This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
My name is Dr. Christina McCullough. I'm a current intern here in the Livestock Service Department at K-State. I graduated from Ohio State University just this past May, and I'm originally from Western Pennsylvania. So I grew up around dairy cattle, and that's kind of my background. And so I'm here at K-State doing a specific training in livestock service. I'm here to talk about dehorning today. And so the process of dehorning and disbudding, there's a few different ways that we can approach that. So when they're a few days old, some people can use it's a caustic paste, and you can rub that right around where the horns grow on the pole. You have to do this right as when they're a few hours to a few days old, because once they start getting coordinated enough, they can start kind of kicking up and getting that caustic paste on them and licking that and burning themselves in other locations. The next stage is disbudding. And sometimes it's called dehorning, but I like to do this in calves when they're about 2 weeks or a little older. So I don't usually dehorn or disbud anything less than 2 weeks of age. So I'll start at 2 weeks, and then usually the ones that we do here for the K-State dairy are between 2 weeks and a month, or maybe a month and a half old. At that point, they just have kind of little knobs right on the pole of their head, and this is just a little bit of the epidermal tissue. It's not really adhered yet. It's not kind of a horn base. And so what we're able to do here is we're going to block them to help desensitize any of the nerves. And so we'll do a nerve block, and the landmarks for that are at the lateral canthus of the eye and halfway to the distance between the base of the ear. And so we'll give them some lidocaine to numb them up. And then we'll usually use a hot iron for that. And there's a few different hot irons that we can use, and I like to use one that's a ring base, and you kind of just stick that around the base of their horn, and that helps to cauterize and burn off any of the epithelial tissue that they have growing there. And so once you burn that tissue, it helps to destroy any of the epithelium and doesn't let it cornify, so there's no way that that horn can kind of attach and grow. So that helps to kind of help dehorn them at a younger age. And then there's always the process of dehorning, and sometimes when they're a little older, like in this guy here, after they're over about maybe 2 months of age, their horns start to grow, and it'll start to epithelialize down and get attached, and then their horn will start growing up. And at that point, you're no longer able to kind of just cauterize it off and get it with a hot iron, so you might have to use a different instrument. So you can either do a cosmetic dehorn, where it's surgically removed, or you can use some other types of instruments. And on this little guy here, we use what's called a Barnes dehorner. And so we were able to, again, numb him up in a few different locations, so he wasn't really able to feel anything. And we took our Barnes dehorner and kind of chopped off the horn, and in order to further destroy any of the epithelium, so he doesn't get any more cornified tissue to help grow a new horn, or a skurs is kind of what that's called, we were able to dehorn him with a Barnes dehorner, and then stick a hot iron and kind of cauterize any of that extra epithelial tissue that was around there to hopefully destroy all of the epithelium, and nothing will grow from that.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
I'm Rexanne Struve, veterinarian in Western Iowa. I have a veterinary clinic and started doing stem cell therapy on dogs in August of 2014. And after the first 2 dogs, after 3 weeks, I saw such dramatic results. I said, hey, I have arthritis. I have joints, really need this help. Where can I go to get this done? I had stem cell therapy done in November of 2014 on my finger joints, my hip, and the ball of my left foot, all of which I'd had real severe problems with. Saw a pretty dramatic improvement in a short amount of time. I would certainly recommend that somebody don't wait until I'm in the position that I was in with the damage already done to my joints. I encourage veterinarians to use it for their animals, and I encourage anybody who sees this video, if you have need, get in contact with these people, because this is a phenomenal place to have this done.